2010, we have the European Financial Stability Facility, which is the mechanism that is providing loans to member states, especially to the banks, as we have seen also. And then Stability and Growth Pact, and the support packages starting from Greece, then it's going to Ireland, Portugal, and Cyprus at the end. So we have okay, these are bureaucratic, let's say, but they are important in the way that the European authorities are making new authorities, which are over Europe, over any democratic control, okay? So there are, so the European Bank, the European Central Bank is one of them, who are making the policy without any control from any democratic procedure. So this is the crisis, which gave, of course, this crisis, it was really a good opportunity for the capital to make an aggressive, really aggressive offensive against mainly labor. So it is a war of the capital against labor. This is the crisis. I mean, if you see all the laws, all the strategy of the European authorities is to break all the laws that were protecting up to now, after the war, protecting labor. So wages, rights, working rights, okay, so it means the hour, the time of working and so on, and of course the working conditions, health and safety and work today means nothing, okay, in terms of the Central European policies. We don't care about health and work, health and safety in work, because if someone has a problem, we have millions of unemployed that are waiting in the door to take his or her place. So labor was the main, and then of course, the characteristics coming up with that are the welfare state, which, mind you, was produced after the Second World War. The welfare state was a very good example and success up to a point of the Keynesian approach. Okay, after the war we have destruction of capital. After the war, we are going to remake all the capital. So we want a lot of people to work, and because we want all the people to work, we are making mechanisms that are protecting the health of the people in order to have healthy workers, in order to work better and more effectively for our interests. And the last, but very important, which has to do also with everything, is the public space. The strategy that the system has today is to erase any motion of public space. Just public hospitals, no. Public schools, no. Public universities, public ports, public airports, public. So public is under a really aggressive offensive, and of course the neoclassical or neoliberal approach to that is that the public, all public institutions are lazy, are bureaucratic, they are not effective, and there is also a lot of corruption. And the opposite is the private sector that is very effective, it's very quick, it's very cheap, so we need that. And this is the dilemma that the system is putting to us, and we are going to see what that means for us. So let's go now to Greece after this introduction of the setting, and see some figures which are actually the causes of the causes. You know the term, I believe, okay? Which is the causes of the diseases are, of course, some specific causes, but the causes that are producing the opportunity to make the disease are the, we call them the socioeconomic determinants of health, the determinants of living or everyday living that are making harm or are protecting health. So what happened in Greece in a very quick, let's say, figure? So 2007 GDP, you see, from 2007, 210 million, to 2012, 167. So we have the GDP, which is the overall wealth. It's not a very good index, but anyway, we have an impoverishment of the country as a whole. Unemployed, 5% in 2007, 20% in 2012 for males. Females, and this is very important, 12% in 2007, 27% in 2012. Overall, today, the unemployment rate is 26 to 30%, which means 1 in 3 of the people that could work cannot work because there are no places to work, there are no jobs. So this, of course, is producing a lot of poverty. The people at risk of poverty is 19% in 2000 at risk of poverty, 19% in 2007, 32% in 2012. So you see an important growth, an important dramatic growth of poverty in the population. And what we're going to see, oops, mistake. What we are going to see after with more detail, the public health expenditure. The public health expenditure is from 12 million euros in 2007. It's 9 million, and now it is even less. So the first approach is that we have all the main determinants of health, which are poverty, work, okay, and general wealth of the society are really deteriorating, which means health is deteriorating also, okay? And in the same time, in the same policies, which are called the austerity policies, we have diminishment of the public expenditure. So that means that, of course, the health indexes are going to be infected by this situation. Here we have from other countries in order to see, for example, Mexico, and to see the differences of economic crisis or mortality, which is important to see. You see, for example, here we have 9%, 10%, 6.9%. Okay, this is not. What I want to show is that there are a lot of trends, but of course, here we have also to stick on the. What is your idea about this, for example? What that means? This line here, that the risk of
alcohol abuse.
Yes. What means what?
What's the item next to it?
Huh?
What's the item next to it?
What I want to say is that the risk which is there, including 0, that is not scientifically significant. Okay. So you have to see here suicide. Anyway, suicide in people aged up to 64. Homicide. You see, these 3 are. And on the other side, we have the alcohol abuse in country years. So these are some figures that are telling us what is going to happen in all countries. And for example, another way to see it is if we have 1 point increase in employment, what is happening in mortality? Okay? So we see that, okay, it's nothing happened really, but suicide. And in health behavior, nothing happened, but overweight, but no leisure time. So these are the intermediate factors, okay? That we don't have immediate, okay, certainly all the people are going to die, of course not. There is a part which are suicide, and the suicide we can understand it because it is, you know, people that were living, we have lived that in Greece, people living in a middle petit bourgeois situation, you know, having small shops and so on, and suddenly they have nothing. They lost their job, they are indebted, the banks are taking their houses, so these people, the majority of these people are those who are suicidal. Okay? So this, of course, is in the beginning of the crisis. But what we see also is that other factors, intermediate factors, which are affecting health are going on, as obesity, as alcohol, and so on and so on. So, under this perspective, you know this approach. The economic crisis is, Levy and Saider are saying here, seriously threatens the health of the public, both in USA and all over the world, and so on, all the others. So it is very well known. It's something that when we started working with that, it was not, I mean, we were questioning if we can say that, if we can make this association, but of course today this is very well known. So, what happened in Europe again is that the World Bank and the International Monetary Fund are getting really deeply involved in the policies of Europe. This is very important for Europe because up to now, the European Bank and the IMF were implementing policies in other countries, but not the central countries of the system, okay, of Europe. So it's the first time that they are involved in those policies. And as for healthcare reforms, what they are promoting or imposing is the reduction of health spending, of public health spending, the introduction of co-payments, the introduction of market-based instruments, and from taxation-based system to health insurance financing system. This is very important. We have seen that, I'll tell you later that. What are the limits of the insurance scheme-based policies? Insurance means that I am insured. When I am insured, when I'm working. So if I work, I have insurance, I have health services. But if I am I'm not working, I am in the part of 30% of unemployed people in Greece, then I don't have health insurance, then I don't have health facilities and health care. And this population, of course, are in the greatest danger, as you could see. So, this is quite interesting, is the change in GDP and change in government spending on health, okay? All these periods. And you see, for example, Greece, which is really an outlier, and we'll see all the other countries here. Greece is having a very negative change in GDP, losing wealth, okay? And on the other side, is in a very negative also spending, government spending in health. So Greece is getting poorer, and also is paying less for the public health services, okay? And this, I think this graph is quite interesting by the Stackler people, the Stackler group, which are making good job on all that stuff. And it is saying a lot about what is happening, not only in Greece, but also in all the world. You see, for example, Sweden is very striking because, of course, Sweden started from a very high level compared to Greece. But anyway, even Sweden has a negative GDP and start to have a negative public health spending for health. So this is an international trend. But for Greece, of course, this is quite striking. So, suicide in the Baltic countries. So these are just to show you that it's not some specific phenomenon for Greece. Okay, it's in Baltic countries. Suicide mortality in Italy, and you see here the connection with unemployment, suicide, okay? And in England also, quite the same. So we have a lot of data, a lot of evidence, and this is very important also to understand, because the neoliberal politicians, they are telling us that we don't have evidence and we are just speaking ideologically, okay? It is the opposite exactly. We have the evidence. There is no at all evidence for implementing neoliberal policies. There is no. There is not. There are all just words, but not without backing those policies in evidence. Spain, the same, okay, and mental disorders, major depression, and so on. I don't want to get into that a long time. So, This is mental health, you see suicides, recession, and this is the case of Greece, of course. Sorry. Hello? Yeah? Okay. So, the beginning of the recession is here, and you see very clear the suicides and the homicides. Homicides mean violence in the society, okay? Which is also not by chance. And you know very well what that means from the Ankara massacre. We have now the Paris massacre, the Beirut massacre. So this is also the strategy of violence, which is an international strategy actually, which of course is killing much more people, but also is driving our societies to another level of power relationships, probably. This we can discuss that, it's a very important thing, I think. Anyway, so in Greek you know that unemployment rate, the growth rate is going down, the unemployment rate is going up, and infant mortality is growing. Infant mortality is up to 5 years, you know that, okay? And it is important to see that in a country of Europe we have high, the infant mortality is coming back again, okay? Infant mortality is quite a good index relating with socioeconomic situation. Actually, the first time we have seen that in the international literature was in the United States, where we had, during the 80s recession, the infant mortality that grew in the United States, which was really striking. So, suicide and homicide, as we saw before, which are going together with the unemployment. Here is the crisis. It is obvious. Here we had a lot of discussions, especially by people, and in Greece mainly, from the system, you know, questioning and saying, what are you saying? It's nonsense. There are no more suicides, because Greece is very well known that we have low suicide rates comparing with Hungary or with Sweden and so on. This is true, it's low, but now the numbers are going up, and the numbers means people, it's not just a number. So, of course, we still have lower numbers than Hungary or Sweden. That means that, of course, it's a lower number of people that are dying because of suicide in Greece than in Sweden, but this is not saying that it's not a danger, because it is growing up, okay? So, the crisis, we have published that, you know that. So, infant mortality up to 51%. Suicide mortality, especially to the young people, and this is very important also. I forgot to tell you before that the unemployment of young people is 55 to 6% of young people, okay? And I'm really glad to see here that the majority, you are young, because in our school, we have this awful situation that, which is called brain drain. I mean, all our students, they are taking the degree of medicine, and bye-bye. They go to Germany, they go to England, they go to Australia, and they are as very low-paid workers, okay? I have people that are working with me, that are working in London for £900 per month, living into a hospital, so they don't have even social life, you know, they're in like a camp of working now. And they are there because there are no other alternatives in their country. So this is a major issue of the crisis. For us I mean for Greece, but for the society also. And it is deliberate in my approach. I mean, the crisis is has very good outputs for the main economic actors in Europe, for Germany, England and so on, because they exactly, without paying any money, any penny, any lira, they let us pay here for the education of the young people, and then they steal our people working there. So it's a very important also war, this, okay. So major depression, the drug use also, especially in the middle-aged groups, is very high. And we had, this is also quite interesting in terms of public health, infectious diseases outbreaks, with the most striking malaria. Malaria was vanished from Greece. We didn't know. I mean, I was raised as a child and as a scientist reading only about malaria, and we didn't know. We haven't seen any case of malaria. Now we have seen. Why? Because what happened was that because of the deterioration of the public funding, they stopped all the preventive, how do you say that, the prevention of the reproduction of mosquitoes and so on, you know, which is a specific technique. It's not just as it was in the past with the plagues, but it's a specific technique. So they stopped that because they were not paying, and after that, in some regions in South Peloponnesus, we had again the outbreak of new cases of malaria. So, from the past, we have a lot of experience, unfortunately, you know that from your courses here, a lot of experience what means when IMF is giving you some money. And we have a lot of experience even from your country here, from all Africa, from all Asia, from all Latin America, where IMF went, they gave them loans because they were in crisis, and then they said, okay, we give you that, but you have to go and to make these conditionalities, which means you have to improve the loans, the possibilities to pay us back. So, what are the main conditionalities? Worldwide, okay, internationally, is specific inflation or fiscal deficit targets and ceilings on public expenditure. So again, this is the target. You have to diminish the public expenditure. You have to privatize everything, which is up to now state-owned or public. Because if they say, if you privatize, you are going to take money, you know, and you're going to give us this money. These days we have a case in Greece. There is a big pressure to sell all the airports, okay? Not all exactly, but 20, because Athens is already a German airport. They want to sell all 28 airports of islands, and which are very good businesses because of tourism, to the Fraport. Fraport is Frankfurt Airport in enterprise. So they want to sell that, and the pressure is to sell all of them, because in this way you are going to find money to pay back IMF. But what is interesting is that the pressure is to ask for the German enterprise to pay us very low prices. It is underestimating the price of every airport. Okay? So, of course, the strategy is not just to give them money back, but it is to destroy every public space, as I was saying before. And the third, liberalizing markets through the removal of regulations and prices and trade. And of course, you know the big threat that we are living nowadays, which is the TTP, the transatlantic trade and so on, which is exactly that. The aim is to liberalize. They call liberalize of market, but actually it would be the dictatorship of markets to every country. It's not, they wouldn't care about what is happening in Turkey, what is the government in Turkey or in Greece. They wouldn't care about that, because the rules are going to be put by the transnationals. And this is, of course, this would be really backwards to middle years, a kind of middle years capitalism, as they say. So what they have done, the conditionality is very, very, you know, some of them. They have put 3 to 5 euros co-payment if you go into the hospital, extension of all-day functioning of home hospitals, free prescription and so on. Anyway, they have put these conditionalities, and you see that as I was saying before, the estimation of the total of this money is not so important for them. Okay? But it is important to put, for example, a 5 euros ticket for every persons when they go to the hospital. Why it is important? Not because of economic reasons, but because it's changing the way we are thinking, okay? Up to now, the healthcare was regarded as a right, so I go to the hospital because I have a problem. Now, I go to the hospital as I go to the market and I buy a car or shoes. I go to the hospital, I have to pay, okay? So this is, the conditionalities are really have a very, very strong ideological smell, let's call it, okay? So, after producing this big needs of health, as I said before, okay, we have the health of the Greek population is deteriorating. Instead of replying to that with more services, okay, what they are doing is to closing down services. And one interesting, which is not, I mean, we saw that in Greece, but it is also very well known internationally as a phenomenon, is that you see here are the exits, or these are the exits from the system, so they are taking pension, they retire and so on. And these are the recruitments. So you can see what is happening in our health services today. It is really the disaster, okay? Because we don't have, for example, one very peculiar but important service is the intensive care unit, where we have the beds, we have all the technological equipment, which is, you know, it is expensive, but we don't have personnel, so they're not working. We don't have nurses actually, so it's closed. And this, of course, is against the health of the people who need these beds when they need. So, what is also interesting is that what they have done in order to implement this reform, it is interesting that they put the Greek government, international experts, offering means that we pay them quite good technical assistance. Okay, so Swedish experts on prescription, German Ministry of Health on DRGs. This is very important. The Greek society has already paid 500,000 euros to the German Ministry of Health in order to give us the DRG system. You know what is DRG, yeah? The diagnostic groups. So we paid them and they gave us a CD. Okay, it is a lot of work, but I mean they want to implement, to put this system of DRGs, which is the neoliberal approach in all its sense. So they want to put that, they want to impose that, and also they take some money. Okay, so this is the idea of how they are working. Task force for Greece for the funds, task force for pricing medicine, and so on and so on. So they have a lot of experts that they send to Greece, they impose, okay? Which all these experts are paid very well by the Greek society, and they are designing how they are going to destroy our system, the leftovers of our system, because so, what is interesting in all this approach, okay, they destroy public health. Why they did, and what they are saying, they say, okay, you have to make these sacrifices. Because after some years, if you make these sacrifices, you are going to go again to development, so you are going to save your people. So you make these sacrifices, make some, how you call it, anyway, when you make patience, make some patience, some years, and then you are going to have a good development. So look what, this is very interesting. In 2010, the European Troika was projecting that if we go further with the austerity programs, the GDP will have this growth. Okay? So in 2012, the growth, we are very well, we are getting bigger economy and so on. And if you see all these lines are the different projections of the Troika about the situation in Greece. And the black is the actual situation, okay, this one. So all are projecting that, okay, make patients for 2 years, 2 years, 2 years, 2 years, but the situation is here, okay? So even this argument that, okay, we are in a crisis, you have to admit that, make some patient, is not real. It's a complete lie. They lie to us that we are going to have this, actually, and now there are a lot of people, even mainstream economists, that are admitting that these policies are making, you know, it is a vicious circle going down, because austerity. Austerity means more people unemployed, more people in poverty. More people in poverty means less consumption. Less consumption means less profit. Less profit means more austerity, and so on and so on. So never is going to be up. And this, now, today, there are even people, economists, mainstream economists, that are saying, yes, we have to stop that. We have, and they are speaking mainly about Keynesian approach, but it is important that they are criticizing, first of all, the situation today. So, this is what, in a way, is driving to what is very well known as TINA. Do you know TINA? There is no alternative. There is no alternative. That this is the only way that you have to go. There is no alternative. Who said that? The famous woman of neoliberalism, Thatcher. And she said that, and it's very important. Okay, she had a strategic mind. She was not a profane. She was very chill and very ruthless, of course. She said there is no alternative. The only way is to go to this way. So the only alternative, which is what they are promising us even today, is the war, which is war with victims of lives, of course, but also wars with victims of, you see the Mickey Mouse here, of civilization, and Coca-Cola, and Windows, of course, and all this. McDonald's also, yes. So, is there any alternative? So this is what they are saying us also in Greece, that there is no alternative, you have to follow this strategy. So we say no, there is an alternative. There is, so it is again TINA, you see, there is an alternative, TINA. So we say that there is an alternative, but this alternative, of course, is the people. And we have some positive, small but positive signs of that in the Greek society. The first alternative that we are living, and we are proud also of that, is solidarity. Solidarity as an alternative to the cannibalism of selfism, okay? Because the system, as it's going down, more poverty, more, I mean, people, they don't have to eat, they don't have their treatment. So what they are going to do if they are alone? At the end, one is going to kill the other in order to take a piece of bread, a piece of a treatment, a drug, and so on and so on. So this is the alternative. There is no alternative that they told us. We say no, there is an alternative. And this alternative is based on solidarity, which means that we don't want to leave anyone alone in this crisis. And we have a very important grassroots movement in Greece of solidarity, solidarity for the unemployed, for the poor, for the immigrants, and now a lot of movement, of course, for the refugees, the wave that we have here in Greece and in all Europe from Syria, but not only Syria, we have Afghani, Pakistani, and so on, Libyan, and so on. So it is a grassroots movement. There is the reply, the alternative, so a movement that's coming from down and not imposed, which is promoting the idea in practice, the idea of social responsibility, okay? We are living in a human society, so we are not only ourselves as persons, but we are in society, so we have to be we are responsible anyway, even if we admit it or not. We are responsible for what is happening in the society, so we have all together to react. React in a democratic, of course, way, so that's why we have a lot of a wealth of experience today in this of direct democracy groupings that are working in different aspects of solidarity, and collective organizations that all together we are trying to not to be, as I said, alone, each one, but to work as a collectivity. So, solidarity, okay, and this is very important for us, doesn't mean philanthropy. Here is one of our tycoon, very rich person who started their career as a family, they call it Bardinogians. This family started their career as they were giving petrol to South Africa, when South Africa had the apartheid, and it was an international boycottage, no one to go there, and they were going. So they are very good people, very clever, of course, and very effective. And you see, what, this is a recent photo. You see? So you see what is this? Euros giving to a poor woman. So we are not speaking, this is not solidarity. This is philanthropy, which is, of course, against the dignity of the people who have the need. So we are not speaking about that, of course. And as Eduardo Galeano said, to make this, because we are always asked, what are you doing? This difference. Charity is vertical, as it goes from the top to the bottom. You see the euros that were going there. While solidarity is horizontal, as it respects the other person all together, okay, as a community, also all together as a society, we are acting, not just as the rich person giving something to the other. So under this perspective, we have produced we have organized the social solidarity clinics with exactly this motto: no one will be left alone during the crisis. So, because we have seen there are a lot of healthcare needs, we started actually with immigrants from Northern Africa. We started this movement, and because they made a strike, a hunger strike, so we had to care for their health. And after that, today we have almost 50 social solidarity clinics all over the country, which are working and are responding to the care needs of refugees, immigrants, and unemployed people. And what we are doing is we are providing, first of all, health services, which means that all the people that are there in the solidarity are working as health professionals, are working in a voluntary, of course, basis in the social solidarity clinics out of hours. So in the morning they are in the hospital, in the afternoon they come there. So we are providing specific health care services with appointments and so on, physical examination and so on. Treatment, this is very nice. I learned yesterday that you have the same movement also, because a lot of people cannot pay. As I said before in the beginning, now they have the co-payment, you know. So if you go to pay to buy your to take your treatment, you have to pay. Not all, but an important part of the price. So a lot of people did not take their treatment, and we had a deregulation of especially the chronic diseases, hypertension, heart and diabetes and so on, because they were not taking their treatment. So what we did is we made an appeal to all the population, and we said, if you have drugs in your house and you don't need them, please give them to us. So we have now a lot of drugs, and we are providing with drugs to the people who are needy. Here is also an interesting anecdote, it is clear, that is happening with the material that they are bringing us, which is of hospital use. For example, a family brought us the person deceased, okay, the patient, and they brought us a lot of material for peritoneal dialysis, you know. So these, of course, are material that we have to give to the hospital. But there is no any procedure. There is no any procedure to receive. The hospital can receive this material because it is illegal. Where did you find it, and so on. So what we are doing, and it is funny but also interesting, is that we are doing a kind of illegal market, black market, to the hospital. So people who are working in the hospital, they go in the night and they put material in the boards there because the hospital formally cannot accept them. So we put them illegally, so we have some more material in the hospital. So, okay, this is not a joke, but it is something that's happening. And the other, of course, service is that we are making referrals to other specialists. Here I have to say, and this is also very nice, Austerity, that we have a lot of people, doctors, working private, specialists, that are calling us and say, I can see 2 or 3 persons per week for free. So, we have a network of this kind of people who are not in the clinic, but they are working as a solidarity network for our patients. This is the part of health services. But the other part, of course, which we think is very important, is the political function of the clinics, which means that we advocate the right to health and show resistance to austerity policies. That means that we are always, in every kind of manifestation against austerity and so on, we are there, and I say austerity kills, and the right to health and so on. And also, we go to hospitals. Here is I have a big hospital in Thessaloniki, and this is saying the obstruction of the hospital for the people who are in need is killing, and this is the social solidarity. So what we are doing is we go to the hospitals and we ask, with the mass movement, we ask the hospital to be open to specific patients that have problems. They have to have an operation, but they don't have money to pay. So in this way, we open a lot of, we open, and today, of course, and this is very positive, we have, these days actually, a new law is going to pass by the government, which is opening the public sector to all people, regardless of insurance or not, which would be, yes, this is very important. I want to say that because I know that here you have a very open-minded and very responsible medical association. The medical association in Athens, instead of supporting the cause of the solidarity clinics, decided to accuse the clinics of causing unfair competition. You see what I mean? Because they say, look, if the patient comes to my office, he has to pay. If you come to your clinic, they don't pay anything. So it is unfair competition. Okay? Due to the unknown work relationship between the clinics and their doctors. So what they are implementing is that there are doctors that are working for free in the clinics. In this way, they are picking clients from the private sector. Okay? So this was the reaction of the medical association. So you have to be even more proud about your medical association. Okay? Because our medical associations traditionally are very, very, very retrograde. So this was actually this is quite recent. We had a big manifestation in all Greece against austerity measures, and we were there. And we have this motto which says, for some people, life has a cost, meaning the cost of money. Okay? For us, life worth is the word. Okay, so it's a different approach we are saying. And we're asking, of course, free of charge access to all our services regarding to the needs. In Selanik, the Social Solidarity Clinic has its birthday. Today, after you see, it is the 20th. On Friday, we have a very good festivity with music, so you are all invited. It's very close, it's 50 minutes by plane. And it's free, of course. Where is this? Ah, yes. I'm sorry, yeah.
But it's for the clinic, huh? The cost is for the clinic.
The cost is for the clinic, yes. And this, yes, you are right, I haven't. The €3 are for, for the expenses of organization, but all the artists are for free. I mean, and we are doing a lot of concerts and a lot of activities in terms of getting support, and we have support, economic support. I mean, because we are buying our vaccines for the children and so on and so on. So we have a lot of this kind of work. Actually, I have to just to remind you to say that all this, in contrary to the Medical Association, we are proud to be illegal. We are completely illegal. I mean, we have not asked for any permission to work here as a doctor, to give drugs. I mean, there are a lot of possible legal issues that really we are illegal. For example, the drugs. They can tell us that we are making a black market of the drug. But we say, yes, we are illegal. Our legality is solidarity. It's very important. So this is one alternative. And the other alternative in terms of organized system is primary health care. Which again, we have a long movement asking and promoting primary health care as another alternative of all the system, which has exactly the same values. You see here, grassroots movement, social responsibility, direct democracy, collective organization. And what we try to do is to relaunch Almata. This was the idea. You remember 78 Almata? A lot of people are telling us, are asking us, but you want to go back so many years to go to Almata? No, we don't want to go back. We want to go further on the good principles that were elaborated during this conference of primary care. And this is what we try to do. And actually today the challenge in Greece is that from the previous government we made a committee, I was coordinating that, a committee to relaunch Almata, and we have already made a plan that we can have a network of primary care based on a district and neighborhood units. So the idea we are promoting now is that we are going to every neighborhood with in terms of more or less 5,000 people in every neighborhood to have a unit of which is of course not only physician, not the family doctor, but it is a multidisciplinary group where you have of course the general practitioner, you can have the pediatrician, you have the nurse, you have the health visitor, you have the social worker, and you have also administration people to back all these procedures. So we can have in every network, in neighborhood, a kind of this unit, and we think, and this Almata, of course, it's not our idea, is that it's very important that the local people is backing that, is taking it in their hands, this unit, and working together. So this is the population implementation, as Almata would say, that to marry the people, the local people with the service in a very productive way. So, and these are very big for you, but this is the system that we are. So these are the units in neighborhood, and for every 5 to 10 units, we are going to have a reference unit, where there you can have your laboratory exams, your diagnostic X-rays and so on and so on, and you can have also the specialist services, cardiologists, nephrologists, gynecologists, and audiologists. So this is the idea. The idea is to go back to the population. And of course, the big question is that, has this any use? Today, we think that it is the only effective alternative to the crisis, the humanistic crisis that we are going now. We have to reply to this crisis, and of course, in order to reply strategically, we have to change our system. But on this way, it is important to save lives. So the only way to save lives is to have a primary care approach, to organize services which are low cost in the community. And this, of course, is going also to be an alternative to the crisis of the health services, because it's going to have an impact of reorganization of the health services. Today, our health services are very deeply hospital-centered. Okay? So that's making a lot of bureaucracy, a lot of inefficiency and so on. So if you have a good network of primary care, it's going to relieve the hospitals from the primary care job, and it's going to give them the possibility to work in a much more productive for the patient way. And last but not least, it is feasible and realistic. That today, yes, it is feasible to make a reform in the middle of the crisis, to make a reform as a first answer to the crisis, as a first answer to the crisis regarding the needs of the population and not the profits of So there is an alternative, we say, and this alternative, of course, is for the grassroots movement. We have to unite with all the world, and you can see here, this is Gezi, you know this picture. And this is Indelma, and this is European people all together. So we have really to go together, all the peoples of the world, actually, not only Europe, but all the peoples in order to make strategies and very clear policies regarding healthcare, because we are in a health specialist setting, but anyway, for everything to have a grassroots movement which can impose new directions for our health and for a society with a lot of colors and with a lot of humanistic approaches. Thank you. So now, tell me.
Soruna katkısı olmak isteyen olursa, yani çeviri de istenirse yapabilirim. İngilizce de sorabilirsiniz.
Thank you, Alexis. I would like to ask about the capacity of these solidarity clinics. How many people use these clinics, or how many clinics, buildings?
How many?
Clinics in.
Okay, yes. In Selanik, as an example, but they are all more or less the same. In Selanik, we have a big dentistry department where we have 2 dental chairs, you know, the dental chairs, which were an offer of dentists who were going to retire, so they gave us so the dental system, the dental service is working with 50 dentists, 50, who are making shifts. So it is working from the morning to night. It is the biggest service that we offer. And of course, we realize that dental care is very, there is a lot of requests for dental care, which is hidden. We don't know that because the people say, okay, it's not important. So this is one part. Then we have general practice and internal medicine, family medicine surgeries, 2. And we have pediatrician, we have psychiatry, psychology, and we have, these are every day, okay? And once a week we have dermatologists, once a week we have a ear, nose, throat, and so on. This is in the clinic. But as I said, we have also a big network of cooperating solidarity people, and we are sending them also to, we are sending invitations. So every day we have almost 50 persons who are getting from us, going through. And altogether, I think now we have a lot of 10,000 people we served these years. It's a very...
Per day?
No, not that. Per day, no, per day is 50 almost.
Can I ask a question? You know that in the Gezi protest, the doctors giving the healthcare for the people outside in the mosque, they had a prison sentence for this. You are doing this illegal, but do you have some protest against you or this kind of
Against us?
Yes, against this movement.
Yes, as I told you, the medical association tried to make something. And also in another clinic in Athens, the fiscality service, how you call that? The Ministry of Economy. They went inside and said, what are you doing here? Are you, making a service without tax? Without paying? So there are some moves that they try to control us, but we don't have more. Because it's a big movement now. So they cannot do anything. They tried, but after when they tried, we had big manifestations with a lot of people saying, don't touch the social solidarity clinics.
I have a few questions.
Good.
One is, you said some regulations were done for the social security package. I'm curious on what issues these austerity measures were done for the social security package. And the other thing is, the healthcare service is, I think, centered at this clinic, isn't it?
Hmm?
It's centered at this clinic. I mean, do you make home visits, or do you go to the field, or is it centered at the polyclinic? The other question. And one more question.
Yeah, the answer to that is that, yes, we cannot, we do want, but we cannot afford to go to houses, to pay, because the work is very big, and all of us, we don't have time, in a way. And another issue also is that we don't have a catchment area. That this only Bornova is, no. It can be from all the cities, so you cannot do that.
And about the social security package?
Now, social security is very important. As for, there are two parts. The package of services is that this is diminishing with co-payments. So they started with the €5. They went there to the co-payments with drugs. And now, if you go to a public hospital and you have a minimum of care, some tests, some 2 days or 3 days of, for example, if you go to give birth, you have a bill of €1,000 in public hospital. Okay? This is the co-payments part. The other, which is also critical, is now, the conditionality is that we have actually to close down the social security schemes. So what they are doing is that they are closing down, they want to close down, first of all, the parallel schemes, that you have a main pension only. I don't know if it's the system here, but in Greece and in Europe we have the main pension, and then, depending on your job, you have other pensions also that coming together, they were making some quite nice, okay? So now what they are doing is to erase all the other pensions and to have only a core. And if you want some other, go to the private sector. See? So it is a core which is diminished. On the other side, they already, the law passed is that they changed the rules. Now you have to have 67 years old to get pension. Before it was 62. If you have, of course, 35 years of proved work. Okay. So what the idea is to erase the social security funds and to open the private security funds. So the private security funds has two main characteristics in my view. The first is that, of course, it is private and not public. And the second is that it is personal. You see what I mean? That I am going to the company and say I want a private pension. So I am making my bargain alone. The Social Security, where all the workers, when you say, okay, we want to make our security and our pension and so on. So it's a difference from collectivity to individuality, yes, and from public to private.
There is a question from the YouTube live stream. They are thanking you for this presentation, and they are asking what are those hands represent? Are they freeing from the crisis or the help? Asking for help, or what are they for?
Altogether. I mean, it's the crisis, but also the hands are different colors, you see. So an artist made that, okay? And it is a crisis that say we are in a crisis, but we are all together.
All together.
So it's the same.
Can I ask a question? As I know you have prepared a new primary health care program for Greece in order to fight against the health results of the crisis. What is your evaluation about how can this program compensate the bad effects of crisis? Can you have an assumption? What is the capacity of a health program, primary health care program, compensate the bad health effects of a crisis? What is your assumption?
Yes, look, the assumption, of course, is in terms of theoretical approach. Okay? So, of course, if the causes of the causes are still there, whatever you do, the causes are making the results in the health of the population. So, of course, it's not, if you make the best health system, it's not going to answer to all the needs that are produced by the disaster, the economic and social disaster of the austerity policies. So we have to change the austerity policies, of course. But on the other side, it is important first to relieve. Okay, and I think this is important not simplistically in a humanistic approach, but also in a very political approach, because you have to relieve the people from the main problems in order to make the people have the time and the brain and the stamina to react to what is happening. Because if a majority of the people has problems of health and of poverty, of course, and all this stuff, so then this is going to the destruction of the society at the end. So you have to have some policies. And the last is that especially the policies of primary care, as I said before, with the implementation of the local population, can be a movement for the right to health, which movement, of course, first of all, is requesting good health services, but on the other side, this movement can go up to the causes of the causes and react to the austerity policy. So it is also strategically, it is in a way what we say that we have to put health in a political way, our political agenda of the government, of the society. We have to put health higher in our range. That health is not only good for the people, but health can be also an important nucleus of policies for the health of the people, but also the environment, the way the questioning what means development. Okay, we know very well we have a lot of common fights against the gold mining and so on, all this. So all this, if you have health as a core, you can really go and question all of the society, how it's built and how it can change.
I have a question, it's not about this topic. It's about OECD smoking rates. Do you know about it? Greece has the highest rates of smoking. Do you know it? I don't know. Do you have any opinion about it?
Yes, Greece and Spain, I think, yes. Yeah, that's true. Yeah, you're right. It is a public health issue, of course. Actually, we have now a trend of diminishing, but very low trend of diminishing smoking rates. The truth also is that all the laws that were implemented, as here, I believe, here I believe only one restaurant was smoking yesterday. They were smoking inside. But in Greece, if you come, all the restaurants, even if it is prohibited, and there is a sign when you enter to the place, say, no smoking, everyone is smoking. So yes, we have a problem of, implementing the laws, and it's very important. Another issue, as you put in public health issues, which also Greece is really the first, is the victims of traffic roads. What? Traffic road? Accidents. Huh? Do you call them accidents?
Yeah, injuries. Injuries.
Okay, injuries the result. Okay. But there is an important, from public health, an important issue. Do we call them accidents? It's the same with the occupational health. Okay? Are the occupational health incidents accidents? Accident means, especially in Greek, it's even more clear because we call it atihima. Tihi means chance. Yeah. Means not chance. So it's a matter of chance. Accident means, okay, it was a matter of chance. Car was going at 120 in a red flag, in a red light, and the driver was a lot drunk, and he killed 3 people. Okay, it was an accident. It's not an accident. We call it crime. And we do the same for occupational health. There are crimes. Why? Because we know the accident is something that we don't know. You know, if now suddenly, I don't know, something is coming, a bomb is coming, okay, you say, where was that bomb? But
and also it's not accident.
Yeah, but after. But in the road and in occupation, we know exactly the conditions beforehand. We know. We know that if a worker is working in and inhaling, I don't know what benzol or so, arsenic or whatever, he is going to have cancer of the lung. We know. So it is a crime. It's not just to see it and say, okay, we have more. Okay, and this also is a very important issue for us in public health, okay? Because in public health, of course, first of all, our duty is to register and see what is happening. But then, when we see what is happening and say, look, the workers working in mining, the red light and the drunk drivers and so on are leading to causes of death, then it's our duty not just to see that, but to raise a red flag and say, hey, to the society, inform, sensibilize, and move the society against these crimes, okay? So the car, it is an issue, and of course it's also an issue as the McDonaldization I showed before, because it's a matter of values also, okay? I don't know you, but in Greece, for example, for a lot of young people, especially men, You know, the car is something that is proving that I am macho. I'm running, I'm making a lot of noise, I'm going through the red lights. It's good. I mean, it is considered as positive behavior. So we have to change also the values. You know, the car is a good mean to go from here to there. That's it. It's nothing more. It's nothing that can prove anything for your personality.
Any comments, questions? Thank you very much.
Thank you.